It was around 1990, and I was with some friends. We were at a Halloween party. It was at the University of Dayton. And so people dress up, and it's sort of a big thing down there. I was in my early 20s, I guess. And so that was the occasion for it back then in 1990. Well, I think, when I began to work here, and I come from a family of people in public service, a lot of firemen in my family, and my sister's a nurse. And so my brother's a teacher, and so public service is, I was drawn to public service here and enjoyed the science. And so for me, when I began to come here and understand what public health was really about, and it was about serving those that were often, ignored or invisible, and that we were a safety net, we were providing a bridge to services. And so I got involved in things like the work, you may remember, Monica, way back when there was the lung bleeding that was happening in children in Cleveland and East Cleveland and some of the eastern neighborhoods of Cleveland. And so we were doing our response to try to understand what was happening with those kids and causing the environmental potential causes of the lung bleeding. And then I got involved in lead poisoning prevention. And over time we got involved in things like infant mortality and now the COVID response and the inequities and disparities we're seeing in health outcomes and overall case numbers that are occurring among Black and brown people with COVID. We've, worked on things like our health improvement planning and community health improvement planning processes where we have elevated racism as a social determinant of health, the elimination of racism as a social determinant of health, and our work around the movement that I'm proud to have provided support for around the declaration of racism as a public health crisis. And so I've been on a journey, I would say, to learn and understand, I think, a bit more about what white privilege really is and how folks who are white can move freely around society and often don't have concerns that people of color do, and how unfair that is. I remembered as I was driving home last night, there was a young fellow that worked here many years ago, and I remember doing some training with him in the field, and he was an African-American young man. And we spent some time talking, and that was back when there were payphones at gas stations. And at times when you're in the field in environmental health, you might be doing paperwork, at maybe a parking lot of a gas station or something, or in a corner, or maybe in a grocery store parking lot. And so we got to talking a little bit about how things were going in the field. And so he said to me, hey, so if you ever parked in a parking lot at a grocery store and doing paperwork and a police cruiser pulls up next to you and says, what are you doing here? And then you've had to pull out your ID or some proof of who you are from the health department to prove why you're there. Has it ever happened to you? And I said, I can't say it has. And then he said, have you ever gone to a payphone here and made a call at a payphone, and then when you finish, maybe take some notes to record the discussion with the food service operator or whoever the client was that you were dealing with, and you have a police cruiser or someone come up and ask you what you're doing at the phone. And I said, it's never happened to me either. And he said, well, that kind of stuff happens to me and people that look like me all the time. And so I always remember that, and I've tried to think about my work and what I can do to right wrongs, to think about racial injustice and ways that we can create a fair opportunity for everybody to be healthy here, and recognize the privilege that I have in my skin that others very unfairly do not. My hope is that people are upset. There's some people I respect that are disappointed in me. They were upset themselves when they saw it. And that hurts people that I respect, people that I've known for many years. And you try to build a reputation based on your body of work. And I'd hope that resonates with people. I believe that I'm in the midst of this. I'm Catholic, and I believe that part of this is my penance for what I've done, and I accept that and what comes along with it. But I think what we have started to do here is at the health department, we've gone through the Racial Equity Institute training with our board and leadership to really understand the history of racism, not just nationally, but here in our community, and how we need to begin to undo what is incredibly unfair and unjust and wrong. We've begun training a curriculum around equity, diversity, inclusion here at the health department, and hope it could be a model for what other folks can do. We were looking at our hiring practices and our purchasing practices and our internal policies to make them more equitable. We've looked at our senior leadership team and the makeup of our board to assure that they represent the community across race and background and gender. And so we've worked on that over the past number of years, and we need to start to expand that work and begin to go to the next level in the sense that we need to figure out how those internal discussions and education that we're having are providing to staff and for all of us as we walk on our journeys, how we can take that education and turn it outward to the community to be better at what we do. And that means often asking people in the community in neighborhoods that often aren't heard or given the opportunity to tell you, how they feel about a program that be implemented, that we're talking to them first, that we are going in with humility, and that we are understanding that if we're working in their neighborhood, that is their community, and we have a responsibility to engage with them if we're going to be doing work before we ever begin a process, before we set foot to start a program. And that's just common sense respect. And so I think we're beginning to do that more broadly. We have a long way to go. And I know as a community we are on a collective journey. And the recent George Floyd murder has really finally struck a chord in our community and around the country in ways that I think can have a lasting effect. Recognizing just how brutal, horrific that was, and how America needs to change, and we can't continue to wait, and it's taken too long. And I want to be part of that. I want to be part of that process. Well, if we go back to first around our community health assessment and health improvement planning, that work around identifying the elimination of racism as a social determinant of health, that was about 10 years ago that we began that process. And I remember going to Detroit as part of a Place Matters team, which really looks at the premise that your zip code is more important than your genetic code relative to your health outcomes, and that place in a hyper-local way and what resources or assets you may have in one neighborhood compared to another can have an impact on your health outcomes. And we were part of a process, actually Sabrina Roberts just reminded me about that recently, where we sat together with folks from a bunch of different races and backgrounds and talked very candidly over the course of almost 3 or 4 hours about race and about stereotypes. And it was the most exhausting and I think rewarding conversation I've ever had. And for me, that's back now 10, 15 years ago, and that was for me a huge awakening about the realities in a way that I had not really understood before. So that for me was the beginning for us. We began then to move, I think in the last 5 years, I would say. We have a diversity committee of the board. I guess it's been in place now for 7 years. We have internal group that's looking at equity and has now has a focus on equity as it relates to the COVID response in particular, which makes sense, but really looking at our equity, diversity, and inclusion activities and providing places where we can talk about the issues and the differences across race and gender and across sexual orientation and begin to understand each other better. So I'd say that the work around that tied to policies and working on our diversity of staff, which still we have a long way to go, I will say, and also around our purchasing practices. I would say, last 5 to 7 years is when a lot of that work began, and we're working now here, and we've taken a slight pause because of COVID, on developing a EDI, equity, diversity, inclusion curriculum for staff to make us better at what we do to serve the people that we need to reach in under-resourced communities. So to me, that's been happening in earnest over the last few years. There's some wonderful people working here. I'd have to say I'm blessed by the staff that is at this agency, their strength, their fortitude, their endurance amidst all of this and the work that we do, and also for their kindness and forgiveness. And I think some are still on the road to decide where they feel about what happened and what I did, but I went and addressed them all yesterday to talk about that. Well, I think the first thing that I asked for was forgiveness. And I addressed them together and explained what was happening and what was about to happen with the news, and apologized. And then I felt at that point that I wasn't asking them to really say anything in a group, in a crowd, and plus we were in there, and it is COVID time, so you want to limit folks in groups we were just in there for a few minutes. Afterwards, most of it came in hallway conversations, or people stopped in, or a text, or an email. People have been voicing support for me, recognizing that people make mistakes, and that the experience shouldn't define somebody, and my hope is that it doesn't define me and the work that I've done since that time. So there are some folks, I'm sure, that are still thinking about what all this means for them, and I respect that. And I do know that people that I care about a lot were hurt, and they were upset, and they've said that they have to think about it a little bit more, and I respect that. So that's what I've been doing lately, trying to think about that in ways that I can do better. Need to find the courage to do that, and I think that yesterday was a very difficult thing to do in front of my staff, and so I would say that I need to have and commit to have the courage to have those conversations at even a higher rate and a deeper level than we have, and to engage more than I have. We're trying to live through this, unprecedented period we're in right now. But we also are seeing disparities in health outcomes between numbers of cases for minority populations versus white population. Actually, African Americans are more than three times more likely to be COVID positive cases than their white counterparts, and have higher rates of ICU admissions and hospitalizations. That's a fact. And so we need to make sure we elevate that, illuminate it, and it is, a tear in a salty sea of disparities and inequities, I recognize. But we need to take this experience going forward and try to push through a lot of the curriculum work we're doing, which is in progress, but more needs to be done. I've got to go around and have conversations with some key staff that have been involved in that work to allow them to ask me questions and to seek their forgiveness. Well, all I can ask is that they hopefully recognize from what I've done so far. I was proud to be part of the discussions, for instance, in East Cleveland when that ARCO dump was cleaned up, where we went in with EPA and met with a number of residents in East Cleveland that were very upset about that site, and worked and committed to clean it up. And I was proud to be part of that process. That I've worked in a number of under-resourced communities in the county in our health district, doing lead poisoning prevention work and education and healthy homes promotion, and in and out of a lot of houses when I was doing a lot more field work. And so I have that experience. We've been working on our health improvement planning process and health assessment process to include, more residents from these neighborhoods that are under-resourced in our discussions directly. And they get to be heard in ways that we hadn't allowed them to be heard in the past or made space for them to be heard. So I would hope, my hope is that that work to date over the last, for the many years I've been at the health department, that they feel that defines me more than this historical but incredibly stupid situation and decision of mine. So I'm hoping that they see that and that they're willing to give me a chance. It was very moving to me, I think, is the main feeling. I'm not perfect. I've made mistakes. People make mistakes, but their support and discussions with all of them yesterday were very humbling to me, and that they were very supportive, but a number of them were hurt by what I said, or I should say hurt by what they saw. And for me, I need to recognize that and own it, and I do, and I need to take my lumps for it. But they've been very supportive of me, and said that they have confidence in what I've done and in the direction that we're taking the agency. So that has buoyed me through some difficult times over the last day. I talked to my parents first and apologized to them. They're in their 80s, and I went and visited them and apologized to them for letting them down. And then I went to see my wife and apologized to her. And then I talked with my kids and apologized to them, and explained that what I did was stupid and embarrassing and wrong. And they were supportive of me. My daughter watched it with me and cried with me. And so now we try to come back around and rebuild. So that's what we did. Well, no, I think they were shocked. I think that, it was a long time ago, but, I'm in a very public position. And, I think that comes with a lot of responsibility. And so I know that they're proud of me. I know that they are. And that requires a lot of responsibility from me, frankly. So I think, that was that'll be something that they'll remember, and it won't be a bright spot about their dad, my kids. And so, my wife is, of course, supportive, but, I've upset them, and I have to own that too. I wanted to say that, I hope the people in the community out there understand, what I'm about, and that I've shown through my actions over the last decades, and what I've done and tried to build bridges, programs, outreach, addressing inequities in the best way I can. Not perfect, but trying to make things better, that's recognized and that counts for something in their eyes. And that's what my hope is. I haven't heard from them myself. I've heard from people that I respect in the community that have voiced their support, and members of my board that I respect, that have voiced their support in this difficult time, and that has been very helpful to me. I think that that creates a lot of responsibility for me too, about maintaining that support and trust going forward, and I recognize that too.